Hey everybody, it's low carb and keto nutrition specialist Amy Berger delivering to you, as always, keto without the crazy. In my work life, I do some freelance writing for various outlets, most of it related to health and nutrition, more specifically low carb and keto nutrition. But in the course of this work, I have to read some current research, which is good that I'm required to do this because it sort of forces me to keep up with the latest research. And it is uncanny that not only the more I understand and learn about the anatomy and physiology and metabolic pathways and all the different things that keto does or a ketogenic metabolism does, and the more I learn and the more of this research that I read, not only is so much of the fear mongering and naysaying about keto flat out wrong, you can almost bet money on it that whatever somebody is saying to scare you away from keto is actually the complete opposite of the scientific facts. And I'll give you one great example in today's video. This is a paper that was published in the journal Nutrients just a little while ago in July 2023. And it's called The Ketogenic Diet and Cardiovascular Diseases. Now, those of you like me who are of a certain age will remember the heydays of the Atkins diet. And the Atkins diet is how I got started in this whole low carb keto thing. In fact, Dr. Atkins was so far ahead of his time and such a brilliant clinician that many years after having read Dr. Atkins' New Diet Revolution the first time, I read it again just a few years ago with so much more knowledge now than I had when I first went low carb. And I was blown away at what was in that book. So I will leave a link in the notes to a video I did of celebrating Dr. Atkins and the Atkins diet. I'm saying that because those of you who are of a certain age, as I am, will remember that when the Atkins diet was super popular, even a cardiologist and even some of the very conventional dietitians, even they could acknowledge that low carbohydrate diets were great for weight loss. The sort of going phrase was, well, yeah, it's you'll lose weight, but you'll just die of a heart attack. Like you'll just make a thinner corpse. I mean, really, truly, that's what they would say. They could acknowledge that it was excellent for weight loss, but what was the point of losing weight if you're just going to clog your arteries and drop dead from a heart attack from all that red meat and all that saturated fat and all those egg yolks? I mean, we're talking about the late 80s, we're talking about the 90s. That was the prevailing wisdom. So there was a ton of fear mongering, specifically about cardiovascular health when it came to a lower carbohydrate diet. And this paper, The Ketogenic Diet and Cardiovascular Diseases, basically outlines several mechanisms by which keto is very helpful for the cardiovascular system. And by cardiovascular system, I mean your cardiac muscle itself, your heart muscle, and your blood vessels, the vasculature, cardiovascular. So the actual functioning of your heart muscle and the function of your blood vessels, like the dilating and contracting of the blood vessels, like to let blood flow smoothly and all that stuff. And so I'll just read you two teeny tiny excerpts. I don't need to review this whole paper, but the ketogenic diet has been shown to have a multifaceted effect on the prevention and treatment of cardiovascular disease. Among other aspects, it has a beneficial effect on the blood lipid profile, even compared to other diets. A beneficial effect on the blood lipid profile. That means your cholesterol. It means your triglycerides. I'm not going to get into the whole cholesterol thing right now. You can watch 800 million other people's YouTube videos, if you want to learn about cholesterol, but saying that even compared to other diets, keto has a beneficial effect on the blood lipid profile. All right, maybe I will get into the cholesterol thing real quick. I'm not a cardiologist, I'm not a physician of any kind, but you don't have to be either of those to read and understand the medical literature or an anatomy and physiology textbook. Ketogenic diets, reliably, almost like clockwork, you can set your watch by it, lower triglycerides. They very often raise HDL. And some people, they don't raise HDL that much, but they tend to lower the trigs, raise the HDL, which makes for a better ratio between those two. And that ratio is a much, much more powerful indicator or risk indicator of a cardiovascular problem as compared to your total cholesterol or your LDL cholesterol. When it comes to LDL cholesterol, in most people, keto lowers the LDL cholesterol. In some people, it raises it a little bit, and in some people, keto raises LDL a lot of it. And in all of these situations, all of them, regardless of whether keto lowers your LDL, raises it a little bit, or raises it a lot, it tends to shift the particle pattern. I'm sure many of you watching are well familiar with this, but for those of you who aren't, it shifts you from LDL particles that are what is commonly referred to in literature as small, dense LDL, and it shifts those to more of a large, fluffy LDL particle. So it's still LDL particles, but the size of the particles is different. And the literature indicates so far at this point that having a preponderance of the large, fluffy particles is not as atherogenic, or it's just not atherogenic at all, maybe, as compared to having more of the small, dense particles. And ketogenic diets, or just carbohydrate reduction in general, tends to induce that favorable pattern shift or particle size shift. So let me read this other little juicy morsel. Summarizing the extensive evidence, the ketogenic diet is a promising nutritional model in the context of cardiovascular disease prevention and therapy. Through its pleiotropic properties, and pleiotropic means it affects more than one thing, it affects multiple things. Through its pleiotropic properties, it is able to influence the cardiovascular system on multiple levels. Scientific evidence mostly confirms its beneficial, even more beneficial compared to other diets, effect on the lipid profile and other cardiovascular disease risk factors. Mic drop, paper drop, except the paper dropped off camera, you didn't see it. But I also want to, so a couple of things. I mentioned the late great Dr. Atkins for a couple of reasons. The first being that that was my segue into this topic, how back then, okay, yeah, you'll lose weight, but you'll just drop dead of a heart attack anyway. No, you won't. And B, Dr. Atkins was a cardiologist. I think a lot of people either forget that or they never knew it in the first place. So I might have just blown some mind, insert head exploding emoji. Dr. Atkins was a cardiologist. And so you have to think that as a cardiologist, he would not have encouraged his patients. He wouldn't have literally taught his patients a way of eating if he thought it would be harmful to their heart function or to their cardiovascular health, right? So mind blown. Well, mine isn't. Maybe some of yours are. But so all these years, all these decades of this fear-mongering and naysaying about keto and cardiovascular health, it's basically the complete opposite of that. And my friend and co-author on our book, End Your Carb Confusion, Dr. Eric Westman, has had, I think now at least 3, possibly more, documented cases of reversal of heart failure in his clinic at Duke University. I just said reversal of heart failure. Heart failure is where your heart muscle is no longer pumping efficiently. So you get really tired, you get short of breath, like there's just all this stuff because your cells and tissues are not receiving the oxygen and nutrients that they should receive if your heart were pumping properly. And there's many, many, different ways to measure the ejection fraction, all the stuff that they measure when you have heart failure. And all of these things get better on keto. He has documented cases of reversal. Now, is it going to work for everybody? No, I don't think anybody can claim that. Has it worked for some people? Yeah. Yeah. You know what I've never heard of reversing heart failure? The DASH diet, the stupid, ridiculous dietary approaches to stop hypertension, the DASH, the DASH diet, the Mediterranean diet, all them heart healthy whole grains. I don't think they ever reversed the case of heart failure, but certainly not eating that stuff seems to help. Okay, moving along. The failing heart muscle loves ketones. The heart muscle loves ketones and it loves fatty acids for fuel. And where can you get lots of good fatty acids and ketones? From a ketogenic diet. Okay, great. Now, also the blood vessels. Very, very, very strong, powerful risk factors for cardiovascular disease. I would go so far as to say causes, but I'm not a doctor, so I won't say that. But massive risk factors for cardiovascular disease are type 2 diabetes, hypertension, and metabolic syndrome. And we could argue that hypertension is a cardiovascular disease because it means that your blood vessels, the vascular part of that, is not functioning properly. So you could argue that hypertension is not a risk factor for cardiovascular disease. It is a form of cardiovascular disease. But these are things that damage the blood vessels. And diabetes, cardiovascular disease is the #1 cause of death in people with type 2 diabetes. Because the chronically high blood sugar and also the chronically high insulin is extremely damaging to the blood vessels. So we stop that, we correct that, it gets better. And these things start to heal a little bit. And there's something called nitric oxide, which is a natural blood vessel dilator. Not nitrous oxide, which I think is the laughing gas that they used to give people at the dentist, not nitric oxide. And like I said, it's an endothelial relaxer. It's a blood vessel relaxer that helps dilate the blood vessels for blood to flow smoothly. And keto diets tend to help improve production or synthesis of this nitric oxide, or vice versa. Chronically high insulin reduces synthesis of nitric oxide, which, maybe that one of many mechanisms that lead to hypertension. And I did a video on the role of chronically elevated insulin and hypertension a while back. I'll put a link in the notes below. And so anyway, bottom line, keto is very good for cardiovascular function. And they have this diagram in here. Actually, I think they have two. They've got two diagrams. They've got a whole diagram on why keto helps the blood vessels. One of them is increased activity of synthesizing nitric oxide, anti-inflammatory effects, inhibition of, clotting and thrombosis, and of course, lower sugar, lower A1C, all this stuff, eliminating sugars, anti-inflammatory and cardioprotective potential of ketone bodies themselves. So not just the reduction of blood sugar and insulin, but the presence of ketone molecules themselves, partially as a fuel for the heart muscle, possibly as signaling molecules that we've only scratched the surface in the research of what ketones themselves actually do. Okay. That's enough of heart function. I just want to touch briefly on some other things. One of my more recent videos talked about keto diets and kidney function, because that's a big one that we hear, keto's bad for your kidneys, when no, as I explained in that video, keto can actually be really, really good for your kidneys. And people say, women shouldn't do keto. Keto is bad for women. Well, keto can actually reverse PCOS. Keto can reduce those elevated testosterone levels in PCOS. It can normalize the follicle stimulating hormone and the luteinizing hormone ratio, which is out of whack in PCOS. doctors who do ketogenic diets in their office, who prescribe keto diets to their patients, will tell women with PCOS, listen, if you are not ready to conceive right now, you need to take protective measures, because when you change this diet, do not be surprised if your fertility is restored very quickly. And I've heard numerous stories of this happening. So we don't want any surprise babies, but there are numerous, there's research papers now documenting cases of healthy conception and healthy pregnancies in women who had undergone fertility treatments in the past and failed, where it didn't take or it just wasn't a successful pregnancy, and then they go on a ketogenic diet and boom, with or without fertility treatments. I've seen at least one paper where there were no fertility, it was just the diet helped it. And then there was a paper where they combined keto with IVF in women who had previously failed IVF. And so then they combined IVF with keto and healthy pregnancies. So, and I started off this video saying I do freelance writing. One of the companies I write for is Keto Chow. You all aware of the delicious, yummy meal replacement shakes, meal shakes that you can get from, camera's back, from Keto Chow? They've got the most amazing flavors: chocolate, blueberry pie, strawberry cream. They've got, anyway, I will talk more about these some other time, but there's a link below. It is an affiliate, but anyway, I write some blog articles for them, and they assign me topics, and they asked me to write about keto crotch recently. Have you all heard of keto crotch? If you haven't, look for my article, but that article won't be published for a few months. I write way ahead of time. So keto crotch is this completely made up, nonsensical thing that hit social media about 3 or 4 years ago. And it's completely made up, and it was designed to scare women away from keto. Keto crotch, basically, they made it sound like if you go on a keto diet, things are going to get a little bit gnarly down there. Like, it's just going to smell really awful. It's going to just, bad stuff is going to happen, you know where. And this is completely made up, of course. It's not a thing. And lots of articles came out debunking this, and Ken Berry did a phenomenal video debunking it. I will maybe include that link here as well, because if you're going to scare women away from keto, well, not only is keto crotch not a real thing, but again, like I said, keto can help reverse PCOS, can restore fertility in women with PCOS. Ken was reporting, and for reasons you can imagine, when you cut the sugar out of your diet and you cut the excess refined carbs out of your diet, not only do women not present with this made-up keto crotch, they actually have fewer yeast infections, fewer bladder infections, fewer UTIs, urinary tract infections. Most women report, and this is anecdotal because who's studying women? But women report improved PMS, not as severe PMS. They report maybe improvement in things like uterine fibroids and fibromyalgia and stuff like this, in skin. I mean, I wrote a very, very long article about the role of chronically high insulin in acne, in eczema, psoriasis, couple of other skin conditions that are not coming to mind right now. Skin tags. So I'm pointing here because skin tags tend to appear on the neck, although they can be anywhere. So it's really, like I said, you can almost take it to the bank. You can bet money on it. If somebody's saying that you shouldn't do keto if you have X condition, it's more likely that keto is probably the best thing you can do if you have X condition. Now, the very, very rare exceptions would be things like there are some inborn genetic errors in metabolic pathways related to fatty acid metabolism. And if you are born with one of these very, very rare genetic, mutation errors where your body does not properly metabolize fat, then you better eat carbohydrate, right? You should not do a keto diet. But those, like I said, very rare, and you would know if you had one of these. It would not be a mystery. Like you would just know. And there are supposedly some cases of porphyria, which is a blood disease. And there's a few different forms, but it has to do with problems with red blood cell formation or function or something like that. And I have read that there are certain types of porphyria where keto is contraindicated, meaning you should not do it. I don't really understand the mechanism there. Anyway, if you have porphyria, you know you have it. So, always check with your doctor on that. But it's just like, I'll just close on that. If somebody's scaring you away from doing keto because of some reason, you should probably suspect that that's all the more reason why keto would help. Maybe not always, right? Like, not, there's always exceptions, but it is uncanny how paper after paper after paper for a long list of medical conditions that are otherwise difficult to treat. There are certain, like, you can lose weight eating a lot of different ways. You can even improve type 2 diabetes eating a lot of different ways. Not everybody needs keto for that. I mean, it's really effective, but there's certain things where keto's not the only way. Might be the best way, but not the only. But there are other things for which keto is the only thing. It is the only diet that really works for at least some people with epilepsy. They're looking at it for Angelman syndrome. Now, most of you probably haven't even heard of that. GLUT1 deficiency, Dravet syndrome, like all of these rare inborn genetic metabolic diseases. I'm trying to think, there's so many now, like, just, I forget their names because they're so rare, but like certain types of glycogen storage disease. Anyway, you don't need to hear all the details. Keto is really good for you. It can reverse non-alcoholic fatty liver, so I'll probably do a video on that sometime. Like, oh, keto's bad for your liver. Nope, not really. You know what's bad for your liver? Diabetes, metabolic syndrome, insulin resistance, too much alcohol, So that's all I'll say. Subscribe to the channel if you haven't already. If you like keto without the crazy, if you want the facts without the fear-mongering, if you want the truth, I'm happy to deliver it to you. So like the video, give me a subscribe, and I do consultations. If you are tired of doing keto with the crazy and you would like someone to guide you to do it without the crazy, check the notes below. I do one-on-one consultations, and I'm also on Patreon. If you want more, live time with me to ask me questions and just chat about keto and all that other good stuff, get on that. And I will see you next time. Thanks for watching.